Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Naha Balada from Roots Community Health Center, reporting for the week of December 12th, 2022. Today, I'm going to do a status update on COVID and the flu, and talk a little bit about schools and COVID, and answer some of your questions about your treatment plan, especially as we head into more of the holidays. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Here in Alameda County, looking at our 14-day total cases, you can see that they're continuing to climb up. They were 3,903 when I reported last week. Heading up as we know. And what I wanted to show today, something that I haven't talked about in a while, is an estimate of the R effective. We talked about this a lot kind of early on in the pandemic, before so much of the population had been exposed or had COVID before or vaccinated. So it was a little easier to calculate back then than it is now. But if you'll recall what the R effective is, it is really an estimate of how much COVID is spreading, or really whatever virus we're talking about or whatever disease we're talking about. And so in this case, we're talking about COVID-19. And when the R effective is under 1, then that means that for every person who catches COVID, they're giving it to less than 1 person. Once the R effective is over 1, then we start to see spread, and we can start to see pretty exponential spread. And so if it's under 1, like we saw, as you can see, kind of back in, a few months ago here, through October and before that, we were under 1. And so that means that cases will decline, COVID will spread more slowly. But the higher that R effective gets, the faster the pandemic progresses, and the more exponential the spread is. And once you're at 1.5, it's really going kind of straight up. So right now we're at 1.34 here in Alameda County, and you can see that it is going up pretty sharply here. So that is very concerning, because that basically means we're in for potential exponential growth with the R effective being this high. And this is something that is on the California tracker, and the link to that is in the post if you want to take a closer look at it. And this is really concerning news, that our hospitalizations are going pretty sharply up. And I really do not like to see this. It was at 138 when I reported last week, now at 254, and 16 of those in the ICU. So I think the good news here is that the ICU folks are staying fairly flat, without a lot of fluctuation. And out of those 254, how many are there because of the COVID itself or because of something else? And then the COVID is added on top of that. It's hard to say. So it's definitely concerning to see these cases going so sharply up at this point in time, particularly before we really get into the winter surge with a lot more cases, which we know is coming, because as you can see here, our wastewater, that's going really, it's almost just completely vertical here. So that's not something we want to see, but it's good that we have this and that we can monitor and keep an eye on it. The other not good news is the number of deaths per day. Last week when I reported, we were at 305, now 403. So this zigzagging has been going on for quite a while, as you can see. But being at 400 deaths per day is obviously very concerning. So we're still over 2,000 deaths per week here in the United States from COVID. So this is not a great place to be as we kind of head into what is shaping up to look like a pretty concerning winter, for a number of reasons. Partly what I mentioned just about the wastewater and the cases and the hospitalizations going up. Those are going up. Hospitalizations are going up across the country. Also, remember our variants. So BQ1 and BQ11 are really continuing to make a major move here And so they are getting close to 70% now. And that's no different here in the California region. There are some regional differences, but here in California, we're actually at 68% of the variants being BQ1 and BQ11. And this is, of course, concerning because these variants are ones that are getting around our prior immunity from prior infection, as well as from the vaccine to some extent. We don't know exactly to what extent. We know that the Omicron booster is giving some protection against the BQ1 and the BQ11. So if you haven't gotten the Omicron booster, that really is your best bet in terms of giving yourself protection. Where we have lost a tool just as we head into the winter months, we've lost our monoclonal antibodies. And I've spoken about that the past few weeks, but I thought that this graph from a journal article in the Lancet, which I've linked in the post, shows it pretty clearly. So the burgundy color there is showing that there's no essentially neutralization by any of the monoclonal antibodies that we have. There's that long list. And basically it means that the BQ11 in particular is not being neutralized by any of these monoclonal antibodies, and the BQ1 just very minimal neutralization by some of them, not enough for us to put those in use it looks like, particularly because the BQ11 is making up such a big proportion. So this is definitely unfortunate news that we have lost one tool, but we have some others. And so we'll talk a little bit about that when we talk about the treatment plan. But the flu is continuing to really give us a lot of trouble. There have been about 120,000 hospitalizations so far this season, and 7,300 deaths from flu this season. That's very significant. Remember, this is mostly in our extremes of age, particularly with our elders and folks with underlying conditions. But also we do have 21 pediatric flu deaths already reported so far this season. 7 of those were reported in the week that's being reported here, which is the week of December 9th. So unfortunately, this flu season is hitting us pretty hard. We haven't seen this much flu hospitalization since the 2010-2011 flu outbreak. So over a decade, it hasn't been this bad. So this is something that we don't know when it's going to peak, when it's going to come back down, but this is flu season, so we tend to expect it to kind of get worse before it gets better. So on that note, I wanted to talk about what can we do? We've got RSV, we've got flu, we've got COVID that are all giving us some trouble. And so what does that mean for parents? What does that mean about schools? And data around what's going on in the schools has been very hard to come by. Actually, it's not even being reported here in Oakland. Oakland Unified School District stopped updating their lovely dashboard back in June. And so you could see that the last testing day here was May, end of May 2022. So since then, we've got none of this lovely, helpful data anymore that we used to have that could help guide us as to what was going on with COVID. And part of that is because there's not as much testing going on. There was very robust testing going on before, but all of this is sort of going by the wayside, and there's much less testing happening. And no dashboard. So that makes it so that we just don't have the information we would really like to have, especially as we are heading into more troubled times here. And the last advisory regarding COVID-19 came from Oakland Unified School District on June 24th. So also no more advisories, but look at what it said back then. It said that we're glad that the cases have peaked and continue to decline. Well, old news, guys. This is, we're no longer in the declining phase. We're in a pretty rapid rise, actually. So we're in a pretty significant ascent of cases. And so this update is not right. And even then it said indoor masking is still strongly recommended by state and county public health departments. So if it was still recommended by state and county public health departments when we were coming down with cases, then surely it is strongly recommended now. And so what are our county officials and state officials saying now? Well, last week we got this press release from the Alameda County Public Health Officer that outlines and describes the fact that Alameda County has moved into the medium tier, and that in order to comply with California's face masking guidance, that masks are now required in homeless shelters, emergency shelters, cooling and heating centers. And also it includes correctional and detention facilities. So our jails and correctional facilities all must now reinstate indoor masks. So we understand why these settings need masks, but it certainly is a little bit confusing as to why schools would not be included in this guidance. And I mean, if we're just talking about the dynamics of transmission, because we know that schools are part of our community and children are part of our community, and our communities are in the schools, our staff that work at the schools are part of the community. So every single day you have mixing at the schools, and then those same individuals go back out into the community, unlike the jail where not that many people are being released every single day. And mind you that in the jail, there's actually quite a bit of testing going on. So why is it that we aren't protecting our schools in the same manner? And so I would just urge that if you are school staff, if you are a teacher, an administrator, if you are a parent, if you are a student, that you really consider protecting yourself and your loved ones and your household members by wearing a high quality mask, especially at this time. I've made no secret about the fact that I think that we should have kept masking and encouraged masking in the schools and required it for staff. People have different opinions about that, but I think that when we're in a tier where we're saying that we need to reinstate masks in certain settings, I don't think there's an argument to say that schools should not be one of those settings. Surely we can't believe that wearing a mask for the next month or two would impair our children. There's never been any evidence to suggest that that's a case, period. But surely for a short term, I think we should all be able to agree that the benefits would outweigh the risk here, because we are seeing quite a bit of transmission. And we know this from last year, we know this from the lead up to the Omicron surge, and we should learn from what we've experienced in these past waves. After the winter holiday traveling from Christmas and New Year's, those usually see record high numbers of traveling, and then people come back and go right back to school. So my preference, I've said it here before many times, is that we actually extend the winter break, maybe take a couple of weeks from summer and tack them into the winter break, so that you can have another week or two at home to work it out and get your quarantine done with before going back to school and mixing and contributing to this more exponential growth of cases. So we already have exponential growth happening now as it is, before we even do our holiday mixing. So I really do want to urge the schools, the school system, the board, parents, teachers, and everyone to understand that as a critical part of the community where mixing occurs, it would be great to see more masks to prevent more exponential spread and outbreaks, both in the school as well as in households, especially our vulnerable households, our multi-generational households. And there's a lot I would like to see happen at the schools, from installing state-of-the-art HVAC systems so that our students can have great ventilation and filtration. We know that has not happened. across the board. And that is probably the most meaningful thing that we could do, is actually upgrade the ventilation in all the schools. So not just a little HEPA filtration unit. Those certainly help. But we all deserve to have good ventilation, and particularly in a country with the wealth that we have, this is something that should absolutely be supported. And it can be monitored with the CO2 monitors. I've talked about those a lot of times before. But unfortunately, these are things that the average parent and student may not have control over, but guess what you do have control over? Wearing a mask. And if you can wear a KN95, they come in lots of cute colors, they come in different sizes, and they can definitely be part of, they can even match your outfits, and they can definitely be part of layers that can help to mitigate the spread, help keep from bringing COVID home at this point in time, and help keep children from contracting it, which could be anything from a respiratory illness that keeps them home and whoever has to take care of them home, or keep it from spreading to others who are more vulnerable. And we know that children can also experience post-COVID phenomena and long COVID. I've talked about that previously, but they're experiencing it as well. And we don't know exactly what percentage or not, but why do we want to find out? We really don't. We want to prevent this just as much as possible. We only get one body, we only get one brain. Our little ones have bodies and brains that are still developing. So let's protect them. If they've already caught COVID before, let's not let them get it a second time. If they've had it twice, let's not let them get it a third time. I reviewed in a lot of detail the cumulative harms of reinfection in last week's briefing. And so if you missed it, you may want to check that out. We do not want to see reinfections. So we want to try to prevent initial and reinfections. So myself and my fellow colleagues and community doctors will certainly be imploring OUSD again to please institute some of the things that we recommend. And lengthening the winter break is one of them. Don't have a lot of high hopes that that one's going to work, but we're going to try anyway. But masks, I don't see any reason why we cannot implement a mask requirement through the winter surge. So that might look like, ideally, from now until we come back down in terms of cases, which maybe, around early February or so. But I think that that would be the most prudent thing to do. And in the meantime, I hope that you will encourage whether it's your children, or if you know anyone who's in the schools, as well as teachers and students, to do what you can to protect yourself now, so that we can reduce the impact of this winter surge on us all. And last but not least, I wanted to touch on your treatment plan. I've been getting a lot of questions about this, because I'm really happy that folks are listening to this idea of talking to your doctor about getting a treatment plan. And not all doctors maybe feel the same way about this, but folks are starting to have the conversation, and that is absolutely step one. So remember, unfortunately, we've lost one of our treatments, but here's the three that we have. And really the top two are the main ones that we're going to hone in on. It's really going to be Paxlovid, which is oral treatment for most people. So folks 12 and up with risk factors. Folks, definitely, if you're over 50, I think you really should be considering that Paxlovid is going to be the way to go if you get it, to prevent you from going into that inflammatory phase of COVID, where it can affect any and all of your organs. If we can nip it in the bud, start treating it within those 5 days, it's an antiviral, it will stop that replication from getting out of control, and you will have the benefit of reducing severe outcomes like hospitalization and death by over 80%, or somewhere around there, depending on a number of different factors, but it's pretty impressive across the board in terms of reducing the risk. Same thing with remdesivir. That one's a little less convenient. It's an IV treatment 3 days in a row, but it's outpatient. We have the same place, Total Infusion at Eastmont, that's able to do this. And the beauty of remdesivir is it's all ages. We also have a little more flexibility with remdesivir. It can even be given to folks with chronic kidney disease, which is helpful, and it doesn't have so many drug-drug interactions like the Paxlovid, and you have 7 days to start it as opposed to 5. But again, sooner the better, the sooner the better with treatment, with antiviral treatments in general. Molnupiravir, much less effective, but if you absolutely can't do number one and number two, it at least can reduce your risk by about 30% of severe outcomes for those 18 and up with risk factors. So I've been getting questions. My primary care doctor says they can't write it for me until I get COVID. And so I've talked to some pharmacy colleagues, and you actually are able to have a prescription called in for if you need it, with the instructions and everything. And there's nothing to really preclude that, at least not right now, because prior authorizations are not required for this medication. And so you could definitely have a prescription on file that says, if you get COVID, start taking this, as soon as you get a positive test, within 5 days of a positive test and symptoms, and with the instructions of what to do with the other medications that you're on. Now, not all doctors might feel comfortable doing this, and it is understandable as to why. One example of where this could get tricky is, let's say they do call in that prescription for you, but then you get started on a new medication after that. Then they would really need to recheck your interactions and maybe give a new order. So I can see why there may be a little bit of hesitation or going back and forth on this. But this is something that we think is important to at least explore. And if your doctor is not willing to do a pharmacy prescription on file, so to speak, then at the very least, you should have it documented in your chart of what is going to happen if you catch COVID. So you should ask them to please make a note. That way, if there's another physician covering for them on call, like over the holidays, where we know that absolutely happens quite a bit, then there will already be a note in there, and there could even be a draft prescription already made up in there that is ready to go. And these are things that we can now do fairly easily within our electronic health records, where we can create an order or a draft or something of the sort that basically has the prescription with the instructions from your primary care doctor. And that way, if you catch COVID and you call the office and someone else is covering, in the ideal world, they will be able to see that order and call it in for you if they're not willing to just do it themselves. Now, the other thing that's coming up is some primary care doctors are saying, oh, well, I'm not really too sure about your drug interactions. So how about if you get in touch with your rheumatologist, your hematologist, your oncologist, whatever specialist that may be prescribing you these other medications that maybe the primary care doctor doesn't feel as comfortable giving advice about. And so if that's the case, great, do a consult. Maybe it's just going to even be a telephone consult with that specialist, and get the instructions from them. And those instructions can go, you can have them, they can go to your primary care doctor. And that way you're not scrambling around in this tiny 5-day window that you have while you're sick, trying to call your primary care and then your specialist and then get the order back. So if you do all this, you've already done a big part of the legwork, even if you don't get that golden prescription in your hand or called into the pharmacy. And so what about this medication interaction when my doctor says, no, I can't do it because you're taking cholesterol medication? And I know we've talked about this many times before, but I'm going to go ahead and just break down and show you the actual tool so that you'll know. And so you can verify this for yourself or even help your doctor out if they're not sure what to do. So here is the Liverpool checker. This is a tool that us physicians are using in order to check if you can take a COVID medication with other co-medications or what the instructions are. And I'm sharing it with you, even though this really is meant for prescribers, just because there is so much confusion out there. And I think it's important to have access to the facts. And so this is something that anyone can look at. I've included the link in the post. But if you wanted to know, for example, if you can take Paxlovid with one of your medications, you can come here and check it out. You will need to know, or at least be familiar with the generic name, not just the brand name, but you can actually type in the brand name here. So you can put in the Paxlovid And you can see it pops up here, nirmatrelvir with ritonavir. So you select that. And then let's say you're taking Lipitor. So you're going to type in atorvastatin, or you can just start to type it in and it'll come up. And we'll pick that. And as you can see, and as we've talked about here before, there is a potential interaction that we know about. And so you can scroll down to see what the actual guidance is. And it says here, the pragmatic approach is to temporarily stop atorvastatin or any other statin. And basically, it gives a lot of detail here, and then you can be restarted 3 days after the last dose. So this is what your physician can do. And if they really feel like co-administration is necessary, which it shouldn't be, then it gives some guidance about reducing the dose and so on. But really, for most cases, you can afford to stop a cholesterol medication if it means reducing your chance of death or hospitalization by 80% from COVID. And 8 days of being off of your cholesterol medication is typically not going to be a problem. So it really depends on what the medication is. There's a lot of detail here, but really it is an important tool, and it's just one that I thought would be good for you to know about. I think most prescribers do know about it at this time, but it really does make things quite straightforward. So let's get armed with as much information as we can and make sure that we have the best plan that we possibly can. And you can also check with the pharmacies around you to see if they do test to treat. Now, admittedly, this is getting more difficult, especially if you're on a lot of medications. This is where we're seeing that a lot of places are not going to be comfortable. So this is why I keep urging to get with the primary care doctor, especially get with the prescribers of whoever has prescribed you the medications that may be an issue. It's really their responsibility to help ensure your safety and that you are protected in the event that you catch COVID, whether that happens on Christmas, on New Year's, when they're on call, or when they're on vacation. You deserve to have access to this treatment. It's a small window of time, but any more hospitalizations and deaths from COVID, we need to be asking the question about why this person did not receive outpatient treatment if they were not able to get it. And so how we're going to be ready for winter, remember, we're going to stock up on masks and tests. And we have plenty of these at Roots Community Health Center. We even have children's KN95. So please email us at admin@rootsclinic.org if you'd like to arrange pickup, or just come on by 9925 International Boulevard in Oakland. Know when and where and for what to get tested. A lot of testing sites have closed down, so please find the one that's closest to you and find out at your primary care doctor's office, do they test for COVID? If they swab your nose, will they send it off for RSV, flu, and COVID? These are questions that we should be asking while we are in the midst of respiratory illness season, and it's complicated by the fact that we need to know what to do in terms of treatment and isolation and so on. We want to make sure that you're up to date on your vaccinations. Please get that Omicron booster if you haven't gotten it yet. Now is really the time. Now is a great time, actually. So if you haven't had COVID in the last 3 months and you haven't had the Omicron booster yet, now is actually a really good time for that booster, because that's going to give you maximum protection throughout the winter surge. So please, 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 if you haven't done it yet or your loved ones haven't, this is a great time, because likely whatever protection that you had from before has probably worn down pretty low by now, and there's really no reason to take any chances when that's a pretty good tool that we have. It's not perfect. We know you can still catch it, but it does still seem to be protecting against the worst outcomes. Know your treatment plan. Just went over it for COVID, but remember there's also treatment for flu. Antivirals for flu are ideally started within the first 48 hours. But once again, if you're someone at risk of doing poorly with flu, well, first of all, you should have already gotten the flu shot. If you haven't, please go ahead and get it. I know that it feels like a lot between the COVID vaccine and the flu vaccine, but it really is important. We're in a great situation of having a good match of the flu vaccine this year to the circulating strain. So it will give you good protection and also prevent the most severe outcomes, and also reduce the severity if you do catch it, because who really has time for flu? Know the signs and symptoms of respiratory distress. I went over it in a prior briefing. Link is in the post. Particularly for little ones, we're seeing RSV. And the most important thing there, since we don't have vaccine or treatment, is that you know if it's getting bad and you need to take them in. And last but not least, I'm going to add here, avoid initial and repeat COVID infections. So we don't want to get it once, but we really don't want to get it again and again and again. And we've gone over why that is last week in detail, but bottom line is this is aging and affecting all of our organs. We are seeing new onset of diabetes. We are seeing neurological issues, kidney issues, cardiovascular issues, strokes and heart attacks. And each infection, each reinfection is cumulative. So basically the burdens are cumulative according to the number of infections. So we are going to want to reduce reinfection. And remember, especially for our little ones, especially the ones that might have been born during the pandemic, where they might not have gotten taken to the doctor as much as in usual times, we really need to make sure that they're up to date on all of their vaccines. This is why we're having a measles outbreak in Ohio. We don't want to see these happening in other places, but with the lack of protection that we're seeing and the amount of unvaccinated children, they're really at risk. So check on the polio, on the measles, on all the things that they're supposed to get by this time. So especially if you know any little ones that were born during the pandemic, we're mostly focusing on them, but really any and everyone should be making sure that they're up to date on all of their vaccines as a general rule. And know if you are someone who's going to take treatment, if you catch COVID or if you catch flu, and make sure that you know what that treatment plan is. If you aren't able to get that prescription in hand, or you aren't able to get one called in for you and placed on file, at least make sure that it is noted in your chart. Make sure that it's already been discussed with any specialist that it needs to be discussed with, and that you know what instructions you're going to follow regarding if you have to pause any of your other medications and so on. And so please stay safe out there, folks. A mask is a great layer of protection for all these respiratory illnesses. And so make sure that you consider that, especially when you're going to be mixing inside of indoor environments. And remember to maintain a balanced diet, get some good exercise, manage your stress levels, consider a multivitamin supplement with additional vitamin D, and get a good night's sleep. Thank you so much for joining us. See you again next Tuesday at 10 a.m.